Treatment-resistant depression is a term that we often use to really describe the type of a depression that has not had any effect by the medication that the patient is taking. For example, a patient may be on medications or may have tried 2 or 3 different medications at a pretty good dose for about 6 to 8 weeks and have still failed to have any response to that. And I'll give you an example for that. A patient was sad, had no interest and no energy, felt hopeless or helpless about 6 or 7 days a week. And after getting 1 medication, 2, maybe even 3 medications at a good dose for about 2 months, patient still continues to have those symptoms without any diminishment. Now that patient by terminology will be described as a treatment-resistant depression. Often patients will come to you and describe using the words such as, "Doctor, I'm at the end of my rope. I have no hope left. I have tried everything." That combined together with looking at the clinical history generally gives you a case for what a treatment-resistant depression is. The depression itself is a very debilitating illness, causing many functional disability all over the world. Now, 1 in 7 Americans suffer from depression, but 1/3 of those will go on to develop what we call treatment-resistant depression, or TRD. Now, treatment-resistant depression is actually quite different in some aspects from regular depression, in that it is more severe in nature. The patients who present with treatment-resistant depression have often tried multiple drugs for their ongoing symptoms without having any relief. The rate of suicide seems to be higher in the patients who suffer from treatment-resistant depression. One of the other factors that separates the two is that patients with treatment-resistant depression generally have a family history of depression as well. And the cases seem to be of a more chronic in nature. So these are the patients who have been suffering from depression for months, even maybe years. So depression is a very challenging illness to treat itself. And when we're speaking about treatment-resistant depression, it makes it even more challenging. So we know that half of our patient population that is suffering from depression get their medications from their primary care physicians. So it becomes extremely crucial for the patients who are suffering from depression, and in this case, treatment-resistant depression, to be able to form a really good alliance with their physicians, to be able to discover what other options are available for them. It's extremely important for them to have a referral network in place where they can see a specialist, a psychiatrist, who's able to look at options that are available for patients who otherwise have not responded to the current therapies. Now, on top of that, there are many support groups that help patients and their caregivers with treatment-resistant depression, as well as many educational seminars offered by many centers that will help patients understand their illness better. So when we're talking about an entity such as treatment-resistant depression, it's really important to make sure that we have ruled out any other potential medical reasons that could be accounting for those symptoms. It is not uncommon to find that patients who have, for example, low thyroid level, or who are anemic with low blood counts, or even have more inflammatory markers, which is that they seem to be very inflamed in their body, seem to have much higher rates of depression. So it becomes really important to be able to rule those things out before we settle on a diagnosis of depression or even treatment-resistant depression. So when we think of depression, we think of depression in a way that affects not just the person who's suffering from it, but whole family dynamic. So depression itself can affect every area and every part of the person who's suffering from it. And not only that, the depression is not like a disease such as having a trauma to your knee where only the knee is injured. When a depression happens to a particular patient, their brain is affected. Their body is affected in that they have low energy. Their sleep is affected in that they're not sleeping enough. And that in turn affects the way they interact with their family, the way they carry out their job. So depression is an illness that is a very holistic and a very global illness. So the approach also must be very global in nature. So when we see a patient with depression, especially with treatment-resistant depression, often you have to employ many different modalities to help with that. And this includes relaxation training for patients who may be anxious. It includes meditation. It includes yoga, psychotherapy, and support groups, along with the medication. For many patients who suffer from treatment-resistant depression, often they describe having no hope about different treatments. Research serves as an extremely important tool for those patients. Research can provide the type of medications that are still under investigation that provide a different way of acting in the brain to help alleviate the symptoms of depression. Now, often when our doctor prescribes us the medications on the prescription pad, there is a story behind how the medication got to that prescription pad. And research is that process that puts it together. So, as a part of our research, many volunteers will often try a new type of a medication, investigational medication that is not approved by the FDA yet. But in doing so, they provide a valuable information about that medication. And what that serves is to also help us better understand what medication would potentially benefit a particular patient with treatment-resistant depression. To give you an example, there are medications right now approved by the FDA that work on certain chemicals in the brain. As a part of a research study, the volunteers could be exposed to a different type of a medication that works on a different part of the brain or uses different chemicals to help either boost the effect of their current medication or switches them to a different medication. Additionally, the research is a very valuable tool in helping patients understand their illness better. As a part of a research, many volunteers who would come into the research process will have a very thorough examination confirming their diagnosis, and also blood work and EKGs done to confirm their medical status. And then those volunteers are seen on a weekly basis once they're on the study medication to ensure that they're having the proper effect. So research really serves as a very important role for those patients who may be suffering from treatment-resistant depression.